My name is Dr. Bora Korkut. I'm working as an academic in Marmara University, Istanbul. I'm an associate professor there, so in the restorative department. And today I'm going to tell you about the composite plastering technique, which we just published, about to publish in a scientific journal. So we call it the CPT technique actually. The CPT is a technique, clinical technique, that we use to improve the marginal contour of a restoration. So how can we use it? First of all, this technique can recontour the marginal part of restoration. It can be direct or indirect restoration, so that the deficiency can be covered with direct composite. This can avoid the marginal deficiencies, therefore the food impaction or the unwilling aesthetic outlook, for example. So it's very useful clinically and very simple to use. I will explain that. The clinical protocol is very easy actually. First of all, we can use it for class 3 restorations, for diastemal closure restorations for the anterior part, and also for the posterior restorations, which can be direct or indirect. If we go for the indirect restorations, of course, we have to use the composite repair protocol for it. But you can use it directly immediately after the restoration, or even after days after the restoration. Therefore, you can use the composite repair protocol. First of all, you are using a mylar strip, the transparent strip for it. So you locate the strip inside the sulcus of the tooth that you are going to restore, or you restored already. So there's a marginal deficiency there. For example, for class 3 restorations, the deficiency is there. You place the transparent strip inside the sulcus, and then you put the composite load inside the tooth, between the tooth and the transparent strip. You pull it there, and then you use the strip actively. How can we use it? We can use it from palatal side to vestibular side, or the opposite, according to the location of the deficiency. For example, if the deficiency is located on the palatal part, you'll use the strip from palatal part to the vestibular part. The most important thing is you should use rubber dam isolation for it, and you should use a transparent strip for it, and the composite should be the paste type composite, which is not very sticky. This is very important. You cannot use, many people ask about that, and you cannot use, in my opinion, flowable composite for it, because the control is very difficult with this one. So when we use the strip actively, we transfer the composite from one part to the other, and the composite fills the deficiency area completely. So this is the main protocol. Afterwards, you remove the strip and you polish the surface, and that's all. You recontour the marginal deficiency surface. For class 3 restorations, you can cover those deficiencies. For diastemal closure restorations, again, you can use this as a second step of the layering technique. For example, if you layer the vestibular surface first, then you can fill the palatal side as a second step, or the opposite is correct. For the posterior restorations, for the posterior direct restorations, first of all, there can be some kind of marginal contour deficiencies just beneath the contact points, which can cause some kind of dark triangles, for example. So those triangles can cause some food impaction. Therefore, you can use that technique to recontour that part and to avoid the food impaction, for example. And as a last one, for the indirect restorations, we cement the indirect restoration there, especially if it's a resin-based one. This is very important because we can repair it. We can add more material on it with the composite repair protocol. So if the marginal deficiency is located between the cervical step of the cavity preparation and the restoration after cementation, then we can fill that gap with that technique again, which is very useful because you have no other act to do that. Otherwise, you have to remove the whole restoration and renew again. So you can fill it with just that technique at the same appointment if you have rubber dam there, and that's all. You can solve the food impaction problem, the secondary caries problem, maybe the discoloration problem. This is maybe not the best, but the most practical and simple solution you can use in your daily practice, in my opinion. The important point here is the transparent strip should be well quality. I mean, it shouldn't be very, very thin, but it shouldn't be very, very thick. So for example, the GC's Epitex mylar strips is very good quality for that, because you can transfer the composite with this transparent strip. So this is very important. And the second point is the composite shouldn't be so sticky, as I mentioned. So for example, you cannot use a sticky composite, but you can use a body shade of accord, chain accord with this. This is perfectly fits that technique. So if you use it with it, you can fill the gap very easily and very correctly. This is the main point. And afterwards, Of course, you have to polish the surface. So again, Epitex interdental polishing strips are perfectly suits that technique. So you can use it afterwards. That's all, nothing to do.